Excellency Prime Minister of Pakistan, Mr. Anwar al-Haq Kakar, Major General Nigar Johar Khan, and Mr. Suleiman Shahabuddin, President of the Aga Khan University. Thank you so much for being with me today, with us today, and for giving me the opportunity to speak with you. And of course, all of my esteemed colleagues, and now I hope dear friends. So I spoke yesterday and was given the task of trying to condense my presentation into 5 minutes. So I'm going to speak quickly and cut slides. That's the strategy. So let me tell you a little bit about the context in which I practice. I practice at Humber River Health in Toronto, Canada. We are a racially very diverse population that we serve, and the catchment that we serve has the first highest number of population that would be considered low income without a degree, certificate, or diploma, and the highest number of racialized population. So there are things we share in common. The people that we serve have a high demand on our health resources. When we started looking at our digital transformation, there were problems that we wanted to solve, some within the walls of our hospital. The ones that I'll highlight are we had very long wait times. Patients, when they would come through our emergency department, would wait sometimes 24 hours to get a bed upstairs to be admitted. We also were often at 99% capacity, and we didn't have good real-time information about what was happening in our hospital. So ensuring that we had a match from supply to demand was a challenge. And we couldn't dynamically adjust the resources, right, that we needed to. But we wanted to be bolder than just solving our problems in our hospital. We wanted to address system-wide challenges. So these are some statistics coming out of Canada. We knew that 1 in 11 patients that is admitted to hospital will come back to be readmitted within 1 month of discharge. But we also know that that statistic is 20% higher for poorer patients. And those are the patients that we serve. We also wanted to address hospital-related harm. And we know that 1 in every 18 patients in a Canadian hospital experiences some form of harm. We wanted our patients to come to our hospital knowing that they would be safe. We wanted to lower that number. So we wanted to do more with less because there is huge financial pressures in the health sector. We wanted to attain high reliability, and we wanted the ability to be able to predict when things were going to go wrong for our patients, intervene early, and ultimately prevent these bad things from happening to our patients. So we embarked on our digital transformation in 2005, which included 4 things: getting our information digital so that we could actually know what was happening and it wasn't hidden in paper, getting mobile and connected so we could support the right information in the right context at the right time for our clinicians and our patients, a patient empowerment strategy, and a systems automation. I'm going to focus on the first quadrant on digital information. We looked at all of the data that we had, and we had multiple sources of data: payer information, patient registration, labs, pharmacy, health records. 90% of the data that we were using was stored in our electronic health record. And we're at a pivotal moment at the Aga Khan University Hospital as we embark on the electronic health record implementation here. What we did is we looked at other industries and said, how do they use their data so that they get a good view of what's happening and then actually use their data to drive actions? We looked at manufacturing. We went to a Dell fulfillment facility. We looked at transportation. We looked at military. And what really emerged was the concept of command centers. We partnered with GE and we layered their prediction logic engine over our data so that we could ultimately build a command center of our own, and that's what you're seeing here. We did it in 3 phases. The first was to achieve operational improvements or efficiency. The second was to meet that high reliability target for our patients. And the third is care transformation, and that's the phase we're in now. And I think that was mentioned earlier. We also have a large rural population, and it's about how do we actually use our command center and our information to support them, not just in the hospital, but remotely when they can't get to the hospital. So what I want to tell you today in the few minutes that I have left is that we said we wanted to do more with less. I'm here to tell you that we are doing more with less. When you look at the outcomes of our command center, we were able to achieve 35 additional beds within 11 months of implementing our command center. You know how expensive it is in healthcare to service a bed. But this is without a single dollar of injection and without a single human resource added to our hospital because of the savings we were getting from using our data to achieve operational efficiency. We had improvements in other metrics, like a 34% reduction in the average time a patient has to wait to get admitted, a 52% reduction in bed stays. So people were coming into hospital and able to leave earlier. And in a publicly funded hospital, of course, that really matters for us. We wanted to achieve high reliability. We wanted our patients to feel safer in our hospital. We are a high reliability hospital now. In terms of those hospital harm statistics that I described earlier, we have now seen a 29% reduction in hospital harm when we compare ourselves to the rest of the province. And we now have a medication error rate that is close to zero. We are at 0.03%. When we started this out, the country was somewhere around 8 to 11%. The country is now down to between 3 and 5%. And that's where we are. But this is because of the technology that we implemented and how we used that technology to achieve our initial vision. I also said the last one is that we wanted to be able to predict when bad things were going to happen to our patients, intervene early, and prevent those bad things from happening. So this is just one statistic that I'm going to share with you. We are using data to now do this. Since implementing from 2019 to 2021, we had a 41% reduction in cardiac arrest and code blue in the hospital because we could use the data that we had to see that our patients were starting to deteriorate, intervene earlier so that this never happened, so that we could decrease the likelihood of them actually having a code blue. That statistic is enormous. And we're not the only people that are doing this kind of work. But it's because we are data-driven that we can achieve this kind of end result. And so I say as we close that your future is full of potential, and that's what we should set as our standard. And it is absolutely something that you can achieve as you embark on your digital transformation. Thank you for your time.